Patient Education and Health Promotion. This is from Chapter 54 in EGANS for the respiratory therapist. Welcome to RES 200. Learning objectives. Learning objectives include write learning objectives in the cognitive, affective, and psychomotor domains. Compare and contrast how adults and children learn. Describe the methods used to evaluate patient education, as well as explain the importance of health education, identify the settings for appropriate implementation of health promotion activities, and describe the respiratory therapist's role in disease management. We'll talk about all of these important education aspects today. If we think of patient care as customer service, which it is, then we can't ignore education as a vital component of that service. Whether we buy a car or a television, we expect the person that we're buying it from to educate us about all the important aspects of our purchase. We also expect this information to be provided in writing. Likewise, education for patients is an essential component of patient care. For patients to assume or resume control of their health, they need to be educated. They rely on the healthcare practitioner, like respiratory therapists, to provide that education. Every respiratory care education program should include instruction regarding patient education. And that's why we're talking about this vital component of patient care today. Patient education includes an appreciation for cultural diversity. Culture refers to the patterns of beliefs and behaviors that are shared by members of a population. That population could be a religious preference. It could be growing up in a very small town. It could be growing up in a city. It could be growing up in a different country. It could be many different things. Some cultures don't recognize illness when symptoms aren't present, like in chronic illness. So the need for ongoing care can be a real challenge. This occurs with asthmatic disease management. When asthma is under control, the patient may not have symptoms. And in those cultures that don't recognize disease when there are no symptoms, the patient may stop taking his or her medication because they don't understand that the symptoms went away because they were taking the medication as prescribed. There's a risk associated with patients misunderstanding therapy or medications. This is not related to the patient's ability to read. It's about the patient's culture and their beliefs, their health beliefs, and their ability to think about and understand the information well enough to follow the instructions, to take a medication every day, even when they feel well, to be able to know when to reorder a medication, and how to complete a therapy necessary for lung disease and lung health. Health literacy. Health literacy is the degree to which an individual has the capacity to obtain, process, and understand basic health information and the services needed to make appropriate health decisions. Healthcare information, like medication instruction, is complex and often requires critical thinking skills. Health literacy encompasses educational, social, and cultural factors that influence an individual. Respiratory therapists need to understand where the patient is coming from in order that including the patient's beliefs, their values, their cultural norms, and all the things that influence the education that's provided to them. Low health literacy affects patient safety and the ability for the patient to participate in care and results in poor health outcomes and increased risk for the patient. Respiratory patients will not be able to be self-directed and navigate the healthcare system if they don't have the ability to follow the educational programs and the respiratory therapist's instructions. Reading and comprehension may not always go together. Patients often won't voluntarily admit that they don't understand what you've been telling them because they want to avoid being embarrassed. It's really important to determine whether or not a patient understands. So it's important to look for clues that indicate reading or writing is a concern and to be sensitive to prevent any feelings of shame. Things like the patient being repeatedly non-compliant, the patient using an excuse of being too busy, too tired, or too sick to maintain attention when given an instruction, claims that the patient didn't feel like reading the information, gave the information to a family member, lost or forgot their glasses, insistence on taking the information home to read, demonstrating nervousness, stress, confusion about materials, wants to talk about something else, changing the subject, or returns documents are not incomplete or illegible. Respiratory therapy patient educators must assess a patient's readiness to learn from the patient's point of view so we can ensure that the patient is comfortable and compliant with the education. Patients that don't want to learn won't learn. What is a performance objective? A performance objective is used for a specific patient education topic that needs to be addressed. Learning objectives help to clarify teaching strategies that are needed for patient education sessions. Objectives should be stated in measurable terms so that the respiratory therapist and the patient can recognize when an objective has been met or accomplished. Clear objectives describe what it is to be accomplished and how you will evaluate if it's accomplished. The format for writing an objective is as follows. Begin with the phrase, "At the end of this lesson, the patient will be able to state what asthma medications they are currently taking." Write the action verb like describe, list, or demonstrate. Write a condition if needed, with or without the use of notes. Write a standard if needed, how fast, how accurate, or when. For example, at the end of this session, the patient will be able to be given a metered dose inhaler and a spacer, and be able to demonstrate the correct technique for using it without error. Action verb, demonstrate. Condition, given a meter dose inhaler and spacer. Standard, without error. Learning domains. Learning occurs in 3 distinct domains: cognitive, psychomotor, and affective. Some learning sessions will involve only one domain. Others will involve all 3. The cognitive domain is very important because it addresses the knowledge that a patient needs regarding his or her illness and how to manage it. The psychomotor domain addresses what skills that the patient will need to acquire or perform specific to treatment modalities, the use of a meter dose inhaler, the use of a spacer. The affective domain involves teaching patients about the necessary attitudes and motivations for successfully living with their disease. So, cognitive domain. This is probably the easiest to translate into learning objective because it involves facts and concepts. Things like list the indications for oxygen therapy, discuss the importance of using a prescribed liter flow, explain the relationship between oxygen and combustion. Any factual information that you expect the patient to understand and apply falls under cognitive domain. Psychomotor domain is repetition and active involvement. So when RTs teach new skills to patient, they need to provide opportunity for the patient to practice. Simple demonstration of a skill to the patient is not enough. To confirm the performance in the psychomotor domain, you must have your patients provide a return demonstration. Be sure to provide help and encouragement as needed. Be patient because not everyone develops skills at the same rate. Some examples of psychomotor domain are perception, prepares and recognizes sensory cues. Manipulate, operate, assemble, construct, adapt, rearrange, reorganize, revise. These are all things. So almost anything, any skill that you want a person to practice would be in the psychomotor domain. Let's talk about the affective domain. Patients' attitudes and motivations influence his or her abilities to learn. It's important to remember that with patient education, timing is everything. Patients who have recently been given a poor prognosis, who are in pain, or not sitting up may not be able to learn. Maslow suggested a hierarchy of needs, and he identified physiologic needs as the most basic of human needs, followed by safety, love, esteem, and self-actualization. Lower level needs have to be first. If your patient has to go to the restroom or needs a cup of coffee, that's going to come first before they're going to want to learn about asthma. Express things that you want to make sure. Getting patients to see with affective domain. You need to get your patients to see how skills will benefit them, and that's a key to motivation. Communicate with your patient that there's something that he or she can do to maintain or improve their health, and a sense of well-being is also important. Objectives in the affective domain, things like using oxygen therapy mentioned earlier, might include the following: expressing genuine concern for yourself by using your oxygen therapy correctly, commit to learn by being an active participant in the program. Affective action verbs are included, such as being aware of, being interested in, valuing, developing a particular attitude, or championing a set of values. Address the patient's immediate concerns first. If they hurt or they want a cup of coffee, make sure they get it. Create an optimal learning environment. It should be quiet, it should be warm or cool, whatever the patient would like. The patient should be sitting up, and get the patient involved as much as possible. Keep sessions short and to the point. Don't let it go too long. Patients will get tired easily. Repeat important information several times. Provide many opportunities for the patient to practice their skills. Be prepared, be organized, on time, demonstrate enthusiasm. Patients can tell if you're not into it, and they won't be into it either. Give helpful feedback. Use evaluation as a learning tool. For example, your 31-year-old patient that's newly diagnosed with asthma is being discharged. She needs instruction regarding how to properly use her controller medication, Advair Discus, and the reliever medication, albuterol metered dose inhaler. So you'll need to develop learning objectives for her and address each learning domain. So, cognitive domain, you want her to describe the action of albuterol on the bronchial smooth muscle and recognize when it's necessary to seek medical attention. Affective domain, agree that it's important not to skip a dose. Verbalize willingness to use Advair Discus daily and feel satisfaction by controlling her disease. Then demonstrate the ability to assemble the metered dose inhaler and spacer, inhale slowly and deeply with an inspiratory hold. Teaching children versus adults. Teaching children is often very different than teaching adults. Children are motivated by external factors like prizes or stickers, as compared with adults who tend to have internal motivating factors. They will do it just because it's helpful for them. This suggests that adults will learn quicker if they can easily see the intrinsic value of knowing more about their illness. They need to know why this is good for them. Also, children may need a more obvious reward system in place before learning can take place. Adults are more independent, and they do not like being dependent on others. Adults should be more involved setting goals, and they will readily learn skills that will make them more independent. Important issues related to the differences between adults and children are: adults tend to question the teacher. Children tend to trust their teachers. So one of the important factors is you have to earn their trust. Adults have rich past experiences and rely on them. Children have limited experiences. Adults learn for the present. Children learn for the future. Adults can learn a little more slowly, especially if they have pain medicine on board or are cognitively impaired. Children learn more quickly and are subject-oriented. Adults are more problem-oriented. They want to solve a problem. Be sure that you allocate enough time for teaching that's required for different ages. Toddler attention span is only 2 to 3 minutes. School-age children attention span is 10 to 15 minutes. Adults and adolescents, their attention span is 20 to 30 minutes. Make sure your lessons are no more than 30 minutes for adults and adolescents. Evaluation of patient education. The critical question remains, when all of the patient education sessions are done, what has the patient actually learned? We need to determine if learning actually took place. Evaluation is the process that answers that question. The method used to evaluate the learning is determined by the measurable learning objectives, cognitive, affective, or psychomotor. Cognitive objectives are often evaluated with the use of a written examination or a verbal examination. Objectives in the affective and psychomotor domains are evaluated with the use of performance checklists. Informal evaluation should occur during the educational process. The RT can ask simple questions along the way to identify whether the patient has comprehended the information. If the patient provides an answer that is not correct, the RT should view this as an opportunity to repeat the previous discussions or to present material in a new way. The RT must never convey disappointment or frustration when patients are having trouble learning new material. Health education. Health education may have been the earliest form of organized health promotion in the United States. Health programs may have started as early as 1850, but really got going around 1875. During that year, the Women's Christian Temperance Union lobbied for alcohol education in schools. As a result, 38 states passed legislation to require this education, which later turned into tobacco, alcohol, and drug education. From that time on, health education has been enhanced and expanded in our schools. There are public health agencies at every level, local, state, and national, and even international, that provide health education and care for those who would otherwise have no care at all. Health education is the process of planned learning to help individuals make good decisions and take responsibility for their health. The primary goal of health education is behavior change, and it's designed to promote, maintain, and improve both individual and community health. Health education covers the continuum between health and disease and between prevention and treatment. Health promotion helps people to change their lifestyles in a variety of settings, from home, school, workplace, healthcare agency, or institution. To be effective, health education must be combined with strategies for health promotion. The two are strongly linked. Although individuals must ultimately assume responsibility for their own health, promoting healthy behaviors through education is an important part of being an RT. In this capacity, the respiratory therapist should serve as a role model for the public. Unless healthcare professionals model healthy behaviors, successful health outcomes cannot be expected from the public. To this end, the American Association for Respiratory Care has created a role model statement to encourage RTs to set positive examples for the public. Providing a good example is not enough to ensure successful health education programming. For desired outcomes to be achieved, certain conditions must first be met. The components are remarkably similar to patient education requirements. Essential components of effective health education are health promotion and disease prevention. In 2012, the United States spent $2.8 trillion, yes, I said trillion, dollars, or about almost $9,000 per person on health care. The top 3 causes of death in the United States are heart disease, cancer, and chronic obstructive pulmonary disease. All 3 lead to chronic conditions that might be preventable by avoiding tobacco use, poor diet, and physical inactivity. Current medical practice is designed to respond to the acute problems of patients. Its focus is on diagnosing and treating the preventing symptoms rather than focusing on the prevention of the disease by identifying risk factors and providing methods for behavioral change. Only focusing on acute or episodic health problems creates a discrepancy when using this model of care to care for chronic conditions that may be prevented or managed. With this in mind, a quote from Rufus Howe is appropriate. "What a rare privilege it is to be in a position to improve the lives of others." Health promotion helps people to change their lifestyles in a variety of settings, from home or school to the workplace or the healthcare agency or institution. Remember, the majority of deaths in the United States are preventable. More emphasis is needed in the healthcare system on disease prevention. Public health model attempts to reduce disease through mass education campaigns are needed. Recent efforts such as Healthy People 2020 have attempted to place the focus of the health of a population rather than on the individual. Let's look at that. Healthy People 2030 now attempted to place the focus of the health of the population rather than that of the individual. Some of the things that it promoted, it had 4 broad goals: to promote quality of life, healthy development, healthy behaviors across all life stages, from a tiny neonate in the womb all the way to being elderly. To achieve health equity, that means health for everyone, regardless of religion or color of your skin or life preference, and eliminate disparities and improve the health of all groups. To attain high quality, longer lives free of preventable disease disability, injury, and premature death. Create social and physical environments that promote good health for all. So, for example of health disparity, because a lot of RTs don't know what that means, is if you live in just from living in a neighborhood, let's say I'm a manager and I am a manager, I might live 5 years longer than the supervisor that's under me. They did a big health study in England, and they found that the higher up you were on the ladder, you would think you would have more stress. They really thought that those at the top of the ladder would die early and would have more stress, and that just wasn't the case. That those at the very top of the ladder, the CEO of the company, those at the very top, lived the longest, and those at the very bottom of the ladder had the shortest lives and had the most health problems. So really, your income, the way you view yourself, where you live, all play a role in your health. And how much stress you have every day from those things. Not just job stress. RTs can take an active role in the development of educational materials to assist both public and other health professionals with regard to health promotion activities. Many medical manufacturers have also developed asthma education kits of various types that include peak flow meters, spacers, and educational materials. These kits are generally developed with input from the medical community and in particular from RTs. Respiratory care educational programs need to be diligent when incorporating health promotion and disease prevention activities into all learning domains as part of their curricula. Another specific area of health promotion that receives much attention in both hospital and public health settings is nicotine intervention, nicotine cessation, and nicotine prevention. Hospitalized patients are more motivated to try to quit smoking for two reasons. The illness that resulted in the patient being in the hospital may have been made worse due to tobacco use, and hospitals have smoke-free environments. Therefore, RTs should use the opportunity to promote nicotine treatments. Nicotine intervention is a progressive, comprehensive program that incorporates a series of steps from risk identification to maintenance support. Smoking is the leading cause of preventable disease and death in the United States. Safe and effective tobacco treatment enhances the success for quitting. Nicotine replacement therapies, NRT, such as nicotine gum, lozenges, and patches are available over the counter. Nicotine replacement therapy combined with behavioral therapy is more effective for tobacco cessation. Things like Chantix and Zyban do not contain nicotine but are available by prescription. Chantix interacts with sites in the brain that are influenced by nicotine. Other programs that RTs can take part in are wellness programs, pulmonary function screenings, and home care to slow disease progression, as well as public CPR instruction. Disease management. The most recent data show that more than 145 million people, about half of all Americans, live with chronic disease. Half of those with chronic illness have more than one chronic condition or comorbidity. The prevalence of chronic disease has increased due to tobacco use, physical inactivity, and poor nutrition choices, obesity, and all of us getting old. At the same time, the cost of care has gone up. These chronic diseases are extremely expensive and lead to unnecessary admissions and readmissions. Chronic care models have been used since the 1990s. A chronic care model is patient-centered. It encourages multidisciplinary focus on self-management and continuous quality control. Patients and families who struggle with chronic illness need planned regular interactions with their caregivers with a focus on function and prevention of exacerbations. The interaction includes systematic assessments, attention to treatment guidelines, and behaviorally sophisticated support for the patient's role as a self-manager. These interactions need to be linked through time by clinically relevant information and continuing follow-up. Multidisciplinary teams such as a physician, RT, nurse, PT, OT, pharmacist, and other health team members work to identify a process for a specific disease condition, use evidence-based guidelines or protocols, collaborate and coordinate the components of a patient's care, use active patient self-management and education to empower and behavior modification, use quality improvement methods, including outcome measurement and evaluation, and use information technology to create a routine reporting and feedback loop. Disease management is a method of applying the best healthcare practices, just like we've talked about, to a population with a chronic illness, one person at a time. Goals should include improving the health of the person, improving patient satisfaction, reducing death, improving quality of life, and eliminating unnecessary medical treatment that increases costs of healthcare. Respiratory therapists and disease management. Our respiratory therapists are ideal to be part of a disease management program. RTs can provide education on health risks associated with disease, education on preventative measures to maintain quality of life, and disease specific to respiratory therapy. Because RTs can practice as both an individual counselor and a public health advocate, depending on the setting or the circumstances, it's useful to examine the most likely settings in which an RT's health promotion and disease prevention knowledge can be put to good use. Some of the settings include healthcare institutions, worksite, home, community, and educational institutions. Thank you for your time and attention. I hope you learned a little about patient education and health promotion. Have a great day.